All right, my name is Julia Jacobs, and I chose horizontal violence in the workplace. So, what is horizontal violence? Horizontal violence is any unwanted abuse or hostility within the workplace. It's very prevalent in the nursing field and healthcare, and it's behaviors including criticizing, intimidation, blaming, fighting among coworkers, public humiliation, name calling, gossiping, isolating, and ignoring. It creates a negative work environment, impairing teamwork and compromising patient care. And the effects include depression, anxiety, work absenteeism, decreased work performance, increased turnover, and decreased job satisfaction. And it also goes by lateral violence or bullying. So my research question was, what are the effects of horizontal violence within the nursing profession? And then my thesis statement was, there are many negative effects of horizontal violence within the nursing field. Horizontal violence not only causes decreased job satisfaction, but also compromises the safety of the patient. So why did I choose horizontal violence in healthcare? Well, there's a high prevalence of it in the healthcare, especially nursing, and I myself have dealt with this while at work. And then so my research, I started with a broad search of horizontal violence in healthcare, then narrowed it down in order to focus on how it affects nurses and the patients as well. Then I started to look at ways at how horizontal violence can be reduced, primarily in nursing. So what did I want to learn? I wanted to learn why this occurs so frequently in the nursing field and what are the effects of it. And I wanted to learn why horizontal violence is so common in healthcare and how to prevent or minimize it. All right, so the first article I analyzed was by Gillespie, Gates, and Fisher. It's called Individual Relationship, Workplace and Societal Recommendations for Addressing Healthcare and Workplace Violence. So this article uses a social ecological model, and it's recommended by the authors in order to stop violence in the workplace. So what is the social ecological model? So it targets the individuals, relationships, communities, and societies. So on the individual level, preventative measures relate to the person's attitudes, beliefs, behaviors of each of the workers. And then on the relationship level, interventions pertain to the employees, relationships between the coworkers, friends, patients, and visitors. So on the community level, interventions address relationships in the workplace. And then on the societal level, interventions reflect cultural and societal norms that may prevent or permit horizontal violence. So when you target all these different levels, it will minimize horizontal violence in healthcare. So this article found that this model was helpful in decreasing it by targeting those different levels. But the limitations with this article is the actual research from this article came from a variety of different sources. So it might not be as reliable because a lot of them were outdated, and so this article itself didn't do its own research. So the next one was by Purpura, Belgian, and Stotts, and it's called Hospital Staff, Registered Nurses, Perception of Horizontal Violence, Peer Relationships, and the Quality and Safety of Patient Care. So it states that horizontal violence comes from the oppression theory, which states that these negative behaviors come from nurses being oppressed or dominated by other. And this is that nurses have less power than physicians and their administrators. So as well, the nursing work environment can be very stressful, so nurses tend to release their frustrations out on their peers. Horizontal violence and peer relationships are inversely related, and peer relationships and the quality and safety of patient care are positive related. So there is no difference in horizontal violence based on the gender, race, age, experience, or working hours. And then nurses who experience horizontal violence perceived less supportive relationships between peers, lower quality of care, and higher frequency of errors and adverse effects. So that shows that the more horizontal violence, the less patient safety there is. Horizontal violence makes nurses more likely to seek another job and or leave the nursing field overall, resulting in a national nursing shortage. So as you can see, the more horizontal violence there is, the less nurses are wanting to stay at their jobs. To minimize the impact of horizontal violence on the quality and safety of patient care, supportive peer relationships need to be established and maintained. So this article was making a point that peer relationships have a big role in keeping nurses happy and keeping patients safe. The limitations with this article is that the response rate to the initial survey was very low. They sent out quite a bit of surveys and not very many nurses responded. And then the group surveyed were predominantly Caucasian females, and they were all living in California. So it may have been biased because it really only targeted a small group of people. So the next one was also by Papura and Belgian. Job satisfaction, horizontal violence, and hospital staff, registered nurses, the mediating role of peer relationships. So they discovered that there was a direct correlation between horizontal violence, peer relationships, and job satisfaction. So horizontal violence was higher for those who scored lower on a job satisfaction. As horizontal violence increased, peer relationships became less supportive, and the more support in relationships with peers, the more satisfied hospital staff nurses were in their jobs. So when hospital staff nurses experience horizontal violence, their relationships with one another may greatly buffer the effects which contribute to their job satisfaction. So the research identified how essential it is for peers to obtain relationships with one another because it can combat horizontal violence within the workplace, boosting job satisfaction. So this article really stated that if there were great relationships among coworkers, that horizontal violence may not happen, and therefore people would appreciate and like their jobs more. So this research article used the same research as the last article I talked about. So the sample size was still very small, and then it was predominantly Caucasian females living in California. So it was a limited survey, and so the accurate may have been swayed depending on the population that was surveyed. So my interview was with Maria Lander, BSN RN-BC. She is a nurse manager on the solid organ transplant unit at Nebraska Medicine, which is where I work. And Maria was a staff nurse for many years, and then she was hired on as the assistant nurse manager, and then recently was promoted to the nurse manager on SO2. So she in total has worked at Nebraska Medicine for 25 years. 2 of those years were as assistant and nurse manager. So Maria is responsible for running the unit, including staffing, scheduling, budgeting, employee performance, and patient satisfaction. So during our interview, I asked her, how does horizontal violence affect the SO2 staff members? And she said it leads to disruption. She said there's a lack of teamwork, and there's a decreased productivity and conflict between all the staff members. And I said, how does it affect the patients? And she says, it compromises patient safety because the staff members are less likely to ask for help when they need it, leading to more errors and mistakes on the nurse's part. And then how do you handle horizontal violence? And she said she always talks to the individuals one-on-one about the incident, and then talks to them about ways to resolve them and what they can do. And then she always follows up with both of the people. And then if there's multiple incidences of bullying with a certain employee, she said she'll then take corrective actions. So is there anything that can be done to prevent horizontal violence? She said they enforce a zero tolerance policy at Nebraska Medicine, and she always educates her staff on the effects of horizontal violence, and she makes sure that every employee knows the standards they're being held to. And then she said that she's a big believer in holding socials outside of the workplace to increase peer relationships. And then she encourages participation in mentorship programs. And then there are my research references. So thank you.